Hello, and welcome to the Washington State Board of Nursing's BONcast. I'm Karl Hoehn, and I'd like to welcome you. I hope you enjoy learning about our state's Board of Nursing, formerly called the Nursing Care Quality Assurance Commission, and specifically about the work we do to ensure the safety and well-being of the people of Washington State. For this episode, we'll hear from our new Executive Director, Alison Bradywood, as she and Kathy Moisio chat about the career path that brought her here and her thoughts about the future of the Board of Nursing in Washington State.
Well, hello, Allison. It's really nice to have the opportunity to sit down and chat with you. I'd like to learn a little bit about you. I think a lot of people would, since you're the new executive director for the Nursing Commission. So I'm wondering if you can tell us a little bit about yourself, maybe your personal life, hobbies, family background.
Sure, happy to share. I have a blended family, 4 kids, so 2 at 13 and 2 15-year-olds. We have tons of interesting discussions and hormones and never a full fridge. And we're a cat and dog family, so 3 cats and a dog. And so you can imagine the volume and the fur factor there. Collectively, we love being outside. We enjoy hiking, and I'm always happiest at the top of a mountain. Ideally, there's water as well. And I also enjoy gardening and cooking. I'm on a softball team, running wherever I can get the opportunity.
Wow. Well, it sounds like a very full household and an active lifestyle, 4 teenagers at once. That's a pretty busy life. What about where did you grow up? Where are you from? And maybe something about your educational background.
Sure. I grew up in Rhode Island. I had a single mom who was a psychology professor, and my dad is an acupuncturist, so very right brain, left brain type of growing up. I've got a single brother who is he's a Renaissance man and currently building a house, and hopefully I can tap into him for some of our projects at some point. In terms of my education, I started in anthropology. Not entirely sure what I was going to do with that, but really resonated with people and culture and that process. And then went into the Peace Corps. I was in Panama in a rural area with an indigenous group. It's comparable to a reservation that we would see in the States. So a lot of early introduction to public health and navigating between the Latino government and the reservation government and looking to support local health clinic there that served about 5,000 people. And then from there, traveled to Hawaii and worked in community health there, did some prerequisites for nursing, and then came to the University of Washington for both undergrad and my master's degrees, and finally Vanderbilt for my doctorate. Clearly grew up in a household that embraced learning and reading and then an appreciation for nature too, which I've carried on.
Yes, clearly. It's such a fascinating background. And it sounds like or feels like maybe your experience in the Peace Corps sparked your interest in public health and nursing, just seeing the needs of the people. Is that correct?
Absolutely.
Yeah.
Yeah. So always really embraced social behavioral dynamics and population studies, and getting to this remote area and seeing firsthand how people were struggling with access to care and the health systems that interacted with the group was phenomenal. And so I think one of the pivotal moments was trying to participate with the doctors from the Latino Ministry of Health and support them coming into the reservation. And they try to do it quarterly for vaccination of kids. And without fail, one of 5 things would be missing. So all we needed was vaccine, ice, a doctor, a boat, and a driver. And
Right.
And we would have smooth sailing, and without fail, one of those things would be missing. And so it actually would only happen about once a year. And it just seemed like the simplest logistics to coordinate, and yet it was incredibly difficult. And so that was really my first introduction to health systems and how you needed to partner across organizations and collaborate to make sure that all of the pieces came together to best serve the community. And that turned me on to nursing, because without nursing in the mix, there was a clear gap between the ministry and what folks needed. So we were able to partner with the ministry and be able to support a nurse being placed at our community center, which really shifted how people receive care and what they received.
Yeah,
So
probably super important in the coordination role. I mean, what a great view of quality and safety and how steps and coordination and communication and collaboration can lead to a safe quality process, or like you say, one missing element and it falls.
absolutely. And really community voice and grassroots development as well. I've tried to stay true to that appreciation for advocacy and voice, particularly for underserved communities through my career. I never thought I'd wind up in a hospital, but I ended up spending 19 years at Virginia Mason in a variety of roles, starting with a nursing assistant. And as I graduated through different areas, really appreciated again how those systems came together and how being data driven and understanding the needs of a team can help to change behavior and change programs and organizations.
Yeah, and they're a community too, right?
Yeah.
So that those principles of working with the community and not for without
Right.
really important wherever you're working. Well,
Yeah,
that's
at
great.
each stage, I've tried to define community because I didn't see myself as fitting into the hospital as easily. It was about, my team on the nursing unit, my fellow nurses, and then students as I became a clinical instructor. As a nursing director, it was my team more broadly and in a different leadership role there. And then as chief nursing officer, it was all the nurses and how do I best support them and give them voice and have them participate at the table rather than for them.
Wow, your community keeps growing. It's now here at the commission, it's grown again. So what attracted you to the nursing commission?
It's really been a similar theme in terms of how to work upstream. And so being able to support numerous nursing communities and the public through the work of the commission seems like the epitome of being able to design the structure and continue to build that structure that will provide support. I think the other piece was in my journey from acute care to long-term care and then community health and working with students, really seeing how the commission is able to target and support each facet of nursing in a different way than I'd been able to do in a singular organization prior. And Margaret Hoehn actually came and spoke with my students in the fall, and I reached out to her without knowing her at all and just asked her if she would come and lecture, and then realized as she was speaking and following that I was just kind of ebullient. This is it. This is where we need to go. This is how you change practice and support communities more broadly. And so the application was open at that time and timing worked out. But I attribute a lot of this reminder of what the commission did to her.
So I guess we have Margaret to thank for you coming our way, Alison. That's pretty wonderful. What is your vision for the commission as you enter this important role?
So being really early on this journey, I think it's important to maintain momentum with the direction that the commission's been going in. I want to continue to assess our environment and see how that evolves over the next 6 months or so. We have a lot of things in motion with the compact going into effect, as well as some other key legislation. And I think it's going to be important to understand the impacts of that before we look at redirecting efforts. I think the methodology, though, has been really important and will continue to be. And part of that is continuing to make sure that we're evidence-based and data-driven and incredibly focused on our workforce, as we know that's important for where we are today.
Yeah, great. Yeah, that compact sure and the legislation adds a lot for us moving forward. With all of that on our plate, what are you most excited about when you think about the next few years with the commission?
So I'm really excited about the opportunity. This is the first time it sounds like that we've been able to implement such incredible nursing legislation that the Nursing Commission is leading. And so that'll be new and exciting. We also have some uncharted waters as far as our post-COVID ability to be innovative as we look at things differently coming through the pandemic. And I hope that that continues broadly for nursing. So I think we have the ability to adjust changes and challenges in our healthcare delivery models and look at how we bring more nurses into practice and ensure the safety of the public differently. We've needed to be creative through COVID, and hopefully this can continue as we look at our workforce.
Well, COVID certainly accelerated the directions we were already in, right? I mean, we were kind of moving in those ways, and then it just was like hyper speed toward change, getting everything modernized and online and out of necessity. What do they say? Crisis breeds innovation, something
Yes,
like
it
that?
certainly does.
Okay, so on the flip side, what do you think are the greatest challenges ahead?
I think it's really our workforce, our ability to augment our educational system and understand our attrition in nursing and look at preventative measures to potentially create new pathways to engage nurses as they look at transitioning their careers are all going to be critical. I think we really need to be creative in this way to help continue to pull nurses in where we can to new ways of working and to encourage them to keep their passion for nursing.
So in thinking of the arc of your professional life, what do you consider to be the highlight or greatest achievement so far?
I think it really has to be mentorship and partnering with others and learning from those that I've worked with and seeing them achieve. When you work directly with a team in operations, you have the ability to affect change and develop people in a large way. And it's been incredible to see those individuals really engage in leadership, engage in safety, and continue to give back to their teams as well. And it's inspiring to watch.
Yeah, it's like a chain reaction, right? They're all flying. That's fun to see. How do you describe your leadership style?
Well, similarly, I think it's really about the team. I tend to be very relational and want to understand where individuals are coming from and their desires for growth and development, and then how can we merge their individual goals with where the organization needs to go so that we both benefit. And I think that's where you get that incredible growth in people and joy in work. I think we'd all rather be challenging ourselves and leaning into where we're passionate in order to be able to achieve for the organizations that we're working with.
Right. So your leadership style really feeds your passion for mentorship. Those are very much intertwined.
And it's more fun to do anything together, right?
And, I'm convinced that we get more done when we're having fun at work. I'm convinced of it. So what qualities do you value in a management team?
I always value integrity and transparency, and a good sense of humor goes a long way, of course. And then that strong sense of togetherness, everybody being willing to roll up their sleeves when it's hard and join together for a common outcome. And the support that we see in ourselves and for each other in those highlights and in the low times make it more valuable together.
I'm going out on a limb here. I'm guessing you played team sports growing up.
I did.
It's obvious. Yeah.
Yeah. Softball, field hockey. I'm still in a rec league for softball in the summer. It's a good time.
Well, it makes sense. It seems to carry over into your leadership styles. So. And then my last question for you is just asking about what you see as the relationship between policy and nursing practice.
Yeah, this is a good question. I really see policy as structure that practice is scaffolded upon. And ideally, policy should provide that support and boundaries, but also allow for flexibility in the interpretation because there's such a variety of settings for nursing, and we're seeing more and more as technology evolves. And so we want to be supportive and encourage and really reach for that ceiling of scope of practice, but not constrain it at the same time.
Do you see practice shaping policy and policy shaping practice as sort of a co-iterative process?
Yeah, I think it has to be dynamic. I think we learn from the environment that we're working in, and that needs to be attributed back to policy so that the policy makes sense and is relevant and feasible. And similarly, policy has to continue to curb and support practice. So absolutely, yes.
Yeah, it's interesting how they relate. And then when we use, as you said, evidence-based for the policy, you've got your research in there and your data. So it sounds like you're ready for an adventure ahead and have all the right tools and background to lead us forward. I'm just very excited to have you here, and I thank you so much for taking time to talk with me today.
I'm just thrilled to be here and to be working with such a fantastic team. And the future is bright for nursing. It'll be an exciting journey.
Great.
Thank you.
Well, thank you.
On behalf of the Washington State Board of Nursing, thank you for listening to our BONcast. Be on the lookout for future episodes.